How are you? Not doing so good, I know. So I heard. I took a look at your chart and I saw that you've been experiencing some severe vertigo as well as chest congestion. All right, I'm sorry to hear about that. So I'll ask you some questions about that before I begin the exam. But first, my name is Dr. K, and I'd like to verify your first and last name and your date of birth. Excellent. Okay, and so when did these symptoms begin? 3 weeks ago, okay? And what came first? Did the dizziness come first or did the congestion? Okay, so kind of at the same time. Did you remember coughing anything up? Is there a lot of phlegm that you're producing, or is it just the feeling of congestion that there's something stuck in your throat? Okay. All right, and what color was the phlegm? Okay. Any numbness or loss of sensations? Okay, in the face especially? No. Do you remember having a fall? Okay. What about any sleepwalking patterns? So, do you ever wake up in a different room than what you fell asleep in, and due to sleepwalking or activity that you didn't remember while sleeping? No. Okay. I'm going to ask you about your current diet and lifestyle. Are you on any medications? Okay. How many milligrams? 100. That is a normal dose, but I want to know how long you've been taking it. Okay. And it's been working for you. Oh, good. Okay. Any vitamins or supplements? All right. Vitamin D. Do you follow any special diets? Do you exercise regularly? Very good to hear. And so with the dizziness, has that been impacting your ability to exercise and walk? Sorry to hear that. We're going to try to get to the bottom of this. Absolutely. Do you have any family history of hypertension? Okay. Blood disorders? No. Neurological disorders? Okay. Can you tell me a little bit more about that? Okay. And at what age did he get that? Okay. Okay. And on a scale of 1 to 10, how would you rate your pain right now? All right, let's start with the vertigo. About a 4. And the congestion? Okay. All right. I'm going to put on some gloves. I'll be doing a cranial nerve exam as well as a full body exam, okay? So, and let me know if you have any questions along the way, okay? Great. All right. I'm going to go ahead and start with your vitals, okay? So could you take a deep breath for me? Okay. All right, now breathe normally. All right. I do feel an irregular heartbeat. Do you have a history of heart murmur? No. Okay, I'm going to listen on the bell side as well. Okay, I'm starting to hear S3, which is abnormal. I'm going to go ahead and write that down. S3 present. Okay. All right, I'm going to listen a little bit more. I do hear some extraneous noises. Okay, could you take a deep breath in for me again and out? 2, 3, and out. 2, 3. Okay, I'm going to go ahead and listen to your lungs. So now I want you to go ahead and take those deep breaths for me again, okay? 3, 2, 1, and okay. All right, gonna listen on the other side. In, 2, 3, and out, 2, 3. Okay, in, 2, 3, and out, 2, 3. Okay. I am hearing some congestion in the lungs. So, do you smoke at all? No? Okay. All right, that's very good to know. I'm going to go ahead with your blood pressure. Okay. I'm going to go ahead and use this arm, okay? So I'm going to slide it up. Very good. Okay. And make sure your legs are uncrossed for me. Yes, they are. All right. So, all right, so just relax. Okay. Okay, that's 140 over 30, so that is slightly elevated, absolutely. All right. I'll remove that for you. Okay. Go ahead and open your mouth. Hold that there. Looks like you are running a slight fever. Okay, I'm really glad that we have you here today. So, I'm going to go ahead and feel your head for concussions and be palpating and percussing. All right. Do you mind if I sit down right here? Okay. Yeah, I'm going to get a little bit closer. It'll just be easier if I can sit. Okay. So I'll be feeling along the tops of your head. Just stay still and try to relax. And you can close your eyes if you want. Any pain here? Okay. Feeling along the back. Mastoid bone here. Okay. All right, I'm going to be doing some percussions on top of your head. I didn't feel any signs of concussion, so that's a good thing to rule out, but I'm going to just feel and make sure that I don't feel any fluid buildup or edema. All right. Okay, normal so far. I'm going to be palpating the face, all right? So just first I'll be feeling and then I'll be listening for any abnormal sounds. Okay, just stay still. Okay. Okay. Don't feel initial swelling. I'm going to be feeling along your lymph nodes, okay? Right here. Okay. While I have my hands on your jaw, go ahead and open and shut for me. Okay, everything feels aligned. So that's good. All right, any pain when I press underneath the eyes? Okay. All right, I'm going to do some percussions now, so just stay still. Good. Mm-hmm. do feel a bit of fluid buildup underneath that left eye, so I'm going to take some measurements. Okay. All right. Okay, I am seeing some asymmetry due to edema on the left side. This left side was 11.5 centimeters, right side was 9. Okay, I'll be measuring elsewhere. Normal. Okay, everything else feels normal, so the swelling does seem to be centralized to here, and it seems to be contained, which is very good. Contained. Swelling. I'm going to test the muscles of your face. So can you open your eyes as wide as you can for me? Good. Any pain there? Okay, good. What about your mouth? Open as wide as you can. Good. Good. Now puff up your cheeks. Okay, I'm going to try to close them. Don't let me do that. Good. All right. I want you to raise your eyebrows. I'm going to try to lower them, or you're going to lower your eyebrows, and I'm going to try to keep them raised on the count of 3. There you go. 1, 2, 3. Good. All right, now frown for me. All right, keep your eyebrows like that. I'm going to try to prevent you from raising them. So on the count of 3, attempt to raise your eyebrows, okay? 1, 2, 3. Good. All right. I'm going to be testing your neck mobility. So on the bridge of your nose, try to look that way. 3, 2, 1. Good. Other side. 3, 2, 1. Good. And continuing on your cheeks, I'll be placing my hand right here. Try to turn your entire head this way. 1, 2, 3. Good. Other side. 1, 2, 3. All right. Any difficulty in doing that? I did notice some weakness on that left side. So, it seems like your muscles have atrophied in the past 3 weeks. So I'm going to go ahead and test the sensations of your face to see if there are any neurological issues, okay? All right. So this is going to be a dull sensation. Do you feel that? Not on the left side? Okay. Do you feel on the right side? Great. We'll use that as the control group, okay? So this is a dull sensation. Do you feel this? Great. That will present as sharp. Okay, so close your eyes. Let me know which one you feel. Good. Okay. Okay. Okay, so you didn't feel anything at all there? Okay. All right, and continuing. Okay. All right. So what I'm going to do is I'm going to be tapping with this side on your skin. I want you to close your eyes. Let me know if you feel the tapping once, twice, or 3 times, okay? All right, let's begin. Okay, no. Let's try that again. Okay. I'm going to be brushing my fingers on either side of your face. Let me know if you feel them equally on both sides. Okay. No. Yes. Alright, so it is underneath that eye area on your left side from here to here that your numbness is at its worst. So I'm going to go ahead and make a note of that as well. Okay. Okay. I'm going to go ahead and test your vision now. Go ahead and look straight up for me. I'm just checking the lid underneath here. Okay. Your lid is pink. It's a nice healthy pink color. I don't see any extra veinage, no jaundice. I'm going to be checking the other eye. Same here. Okay, very good. All right, do you see this light? Good. Let me know when it enters your field of vision, okay? So look straight ahead, don't move your face. Good. Good. Yes. Mm-hmm. Good. 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 Yes. All right. I'm going to make a series of flashing lights, okay? Let me know if you see the lights once, twice, or 3 times. So say 1, 2, or 3. Keep your focus straight ahead. You don't have to look directly at the light, but you should be able to sense it peripherally. Good. Yes. Mm-hmm. Good. That's 4 times. Very good. Okay, so now I want you to just keep your focus on the light, follow it, keep your face straight, don't turn or tilt your head, just follow the light with your eyeballs, okay? Good. Keep your focus right here. Good. Okay. Very good, okay. All right, great, let's switch. So follow my fingers now. Use my fingers, so keep your focus right here, right in my fingers. Good. Very good. All right, did you have any difficulty doing that? Okay, very good. So, this is a Snellen chart. Do you see this? Okay. Go ahead and read that 3rd row for me, right here. Great. Can you read it backwards? Excellent. And this 3rd to last row here. Great. Can you read it the other way? Good. What about the last row? Do you see it? Kind of barely. Can you read it? Okay. I'll read it the opposite way. Good. Do you wear contacts or glasses? Okay, you did struggle to read that last row. I don't think your eyes have been compromised by whatever is going on neurologically because you were able to focus and do all the other tests without a problem. But I do think that is just time for you to up your prescription or perhaps look into getting some glasses. Okay? What color is this? Good. What color is this? Excellent. Which circle is larger, 9 or 5? Good. 8 or 4? Excellent. 2 or 3? It's a little harder. 2 or 3? 3. Very good. Okay. So I'm not concerned with your eyes, but I'm going to go ahead and take a look inside your ears just to check your tympanic membrane, okay? So go ahead and turn your head this way. I'm just going to look. Well, that's a nice pearl gray. No scratching, no scarring. I don't see any signs of excess fluid buildup. Slight wax buildup, but all within the normal range. Okay, go ahead and move your head the other way so I can look inside. Beautiful. Nothing to be worried with there. I'll be testing your hearing now. So I'll be whispering some things in your ear. Go ahead and repeat exactly what you hear, okay? Katie ASMR. Other side. August. Autumn. What's wrong with people? Parkside. Good. Very good. All right. This is a tuning fork. Okay, do you hear this sound? Very good. It's in the key of G. All right. So I'm going to go ahead and play and stopping the sound. Whenever I stop the sound, whenever you hear it stop, say now. Go ahead and close your eyes so you don't see me prompting, okay? Good. Yes. Mm-hmm. Good. Excellent. Good. Good. All right, I'll be coming a little closer with the tuning fork, giving you two options, A or B. Let me know which one's louder, okay? Do you have any questions? All right, go ahead and close your eyes again. Good. Okay. A or B? A or B? B. Good. A or B? Very good. A or B? Excellent, okay. So your hearing is very good. I'm just going to be testing sensationally the vibrations that you hear. I'm going to be making a vibrational sound with this other tuning fork. This is something that you're going to feel more than hear. I'll be putting it against your ear, and when I stop the sound, say now, okay? Yes. Mm-hmm. Mm-hmm. Good. Mm-hmm. Okay. All right. All right, and you haven't noticed anything wrong with your hearing in the last 3 weeks? Okay, very good. I'm going to test your smell and taste, okay? Now, in the last 3 weeks, have you noticed anything with taste? Have you ever tasted something metallic when perhaps there shouldn't be, or tasted something that's not there perhaps when you eat, or have you had any loss of taste? Okay. All right, well, I'm just going to test, okay? So why don't you close your eyes, stick out your tongue. I'm just going to be putting a little drop of flavor on it, and let me know what you taste. Good. Okay. Going to be doing another one. Mm-hmm. All right, excellent. Okay. And now I'm going to have you do the same thing, except instead of tasting, you're going to smell. You haven't smelled anything, any smoky smells when you enter a room? Okay, no loss of smell. All right. Let's go ahead and inhale for me. Oh, keep your eyes closed. Inhale, focus on the scent. Very good. All right. And what does this smell like? It's pine cone, but that's close enough to peppermint where I don't think that's going to be an issue, so very good. I'm going to be doing some percussions and just palpating your chest, okay? I'm looking out for any signs of fluid buildup or congestion that I need to be worried about, signs of excess liquid, which would indicate edema. So just relax and stay where you are. Let me know if you feel any sharp shooting pain, okay? Good. Any pain when I do this? Okay. Pain here? All right, I'm going to be measuring for symmetry. 15 inches. Here. 15 inches. All right. And in measuring your sternum, I do see some abnormalities there, so I'm just going to write down the discrepancies. It's not too much to be worried about, so don't worry about it, okay? Just trying to make sure. Okay, just taking a few more measurements here. Good. All right. Okay. Next, I'll be doing an abdominal exam. With your permission, may I peel back the blanket so I can have access to your stomach? All right, and let me know if you feel uncomfortable at any moment and we'll stop, okay? All right. So first I'm gonna be listening. Keep your legs uncrossed and breathe normally. Okay. Okay. I do hear some acid buildup in the stomach, but that could be due to you drinking coffee this morning and maybe not eating a lot on it or having a lot of acidic food. Oh, okay. Yeah, that'll do it. Okay. Everything else feels very normal. Good. Okay. Going to be palpating and feeling your organs, okay? Your liver feels normal. Spleen is a normal size. So is your gallbladder. Okay. Okay. Very good. All right. I'm going to go a little lower just to feel the lymph nodes with your permission. Okay, this won't take very long. Okay. Okay, very good. Okay. So I'm going to be doing some percussions, just listening for normal fluid. Okay. Okay. All right, everything does feel normal. I'm going to do a sharp and dull test on your stomach, okay? So let me know, do you feel this? Good. Do you feel this? Good. Let me know if you feel sharp or dull. Mm-hmm. Mm-hmm. Yeah. Okay. Okay. All right. Yeah, you are having some numbness on that left side of your tummy, so I just want to do some further inspection and see if it's radiating down your neck and shoulder. So I'm coming a little bit closer and we're going to do a sharp and dull test just along the neck and shoulder area, just along your chest, okay? But otherwise your stomach it's internally very well. It's just you're having some neurological problems with sensitivity. So, all right. So I'm going to go ahead and, is that sharp or dull? Okay. You couldn't tell? Okay. 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 Right behind the ear here. You couldn't feel that. Okay. All right, I'm just going to be feeling the legs for any edema. Okay, have you had any soreness of the legs or any swelling that you noticed? Okay, so I'm just going to be pain there. How about here? A little bit? Okay. On a scale of 1 to 10, how painful was that? Okay, just some pressure. All right. Okay. All right. I'm going to be measuring your ankles, okay? Because swollen ankles is a sign of a lot of problems, so we're going to make sure that you don't have that. Okay. All right. Okay. Next, I'll be checking your feet. All right. So I'm just going to be squeezing the tops of your feet. Let me know if you feel the pressure on your right or your left foot, okay? Good. Both good. Great. I'm going to be doing a Babinski response test now. Okay. All right, good. I'm going to be looking for capillary refill. Great. So no circulatory problems that I see. Very good. Okay. All right. So I'm going to be using the vibrational tool again, okay? Let me know when the sound stops. You should feel a vibration kind of radiating up your entire leg. Good. 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 Excellent. Okay. We're going to do a sharp and dull test on your feet just to make sure that the numbness and tingling did stop in the stomach area and then it hasn't lowered, okay? So go ahead on your right side. This is going to be dull, good, and this will be sharp. So let me know which one you feel. Good. Good. Keep your eyes closed, actually. Mm-hmm. Yes. All right, good. So I'm very happy to say that you don't have any neurological issues that I can see in your feet. I'm going to just do some measurements at the bottom of your feet just to be sure. So just relax. Okay, symmetric and normal. Symmetric and normal. Symmetric and normal. Good. Okay, thank you for allowing me to do this exam. I noticed some things that are big red flags for issues that could be pneumonia. I want to make sure that you don't have any more serious viral infections, but right now I'm guessing that you have pneumonia. We're going to run some tests. We're going to do an MRI, a CT scan, and we're going to have you here for the night, okay? So we're going to check you in. And I will be your resident caretaker, so I'll be coming in to check on you throughout the night. Okay? Well, we just need to make sure that you're not having any serious problems, such as a stroke or anything that's right. And hopefully we'll have you out by tomorrow, okay? All right, we just can't take a chance. Okay, so I'm gonna have the nurse come in and show you to your room, okay? And if you don't have any other questions, I'm going to go ahead and leave, but we're gonna have you feeling good soon. I just need to have some more information before I prescribe treatment. Okay. All right. Thank you so much, and we'll see you soon, okay? All right, I hope you feel better. Bye.